Welcome to Health Center, produced by SUNY Downstate Medical Center. I'm your host, Ron Najman. Would you know what to do if confronted with an active shooter situation? Would you know how to protect yourself? Would you know how to protect the people you may be responsible for? We hope to answer some of those questions today with our guests who have joined us because the Brooklyn Coalition for Emergency Preparedness, which is a collaborative of Brooklyn hospitals and health centers, has put together a symposium and is also going to hold an active shooter drill here at SUNY Downstate Medical Center. Our guests today are Lenita McGee from Global 7 and Dr. Stephen Berger from Baylor University Medical Center. And I'm also joined today by Clarence Bryant from the Emergency Department here at SUNY Downstate Medical Center's University Hospital of Brooklyn. Lenita, could you tell us what exactly brings you here today?
Sure. So SUNY Downstate contacted us after having a relationship with Jacoby Medical Center. We've worked with Jacoby in the past and also North Central Bronx Hospital to do the same symposium for them. The main concern these days, given our situation in society, is how to teach people how to respond to an active shooter incident, whether it's in a hospital environment or when you're in a movie theater, out in public, etc.
And what exactly does your company do?
So we focus on planning, training, and exercising, helping organizations, regardless of whether they're hospitals, oil and gas corporations, etc. The planning piece, what to do in the event of an emergency, who's responsible for what. Training, how to train people, what they're supposed to do, give them realistic scenarios, and then the exercise, which is the conglomeration of everything that we've done. We also focus on incident response. So if one of our clients has an actual incident, we'll bring a team in to help them manage their emergency operations center and the incident using some of the capabilities that we bring to the table.
And Dr. Berger, you're an emergency medicine physician, correct?
That's correct.
And you, of course, you're also familiar with the statistics of these shooting incidents. And can you give us some kind of a sense of whether these are increasing and whether people are more at risk?
Well, there has been a trend toward an increasing number of these active shooter events, not specifically at hospitals, but throughout communities. And the severity of injuries is progressively increased. So it's become a greater threat.
And what do emergency physicians and emergency department staff members need to know in these situations?
I think the biggest thing, and that is my piece, is the medical aspect of dealing with these incidents. We have law enforcement personnel dealing with that aspect, but from the standpoint of handling the casualties, hemorrhage control would be the biggest preventable injury. If we can get people to focus on hemorrhage control early, not early before people go into shock, not once they go into shock, we have a much better chance of saving lives. There's also airway, just simple airway maneuvers, and other simple, really basic life support maneuvers that people need to be reminded of and trained toward in an incident and dealing with the consequences of these of the casualties. So whether the incident occurs in a hospital or whether it occurs somewhere else in town that's brought to you, training people both to deal with it at the scene, but also once they get to you, how are we going to handle these casualties? Especially if we get inundated with a bunch of casualties that there's not enough OR space, we've got to be the first responders, so to speak, in the ED. Do we have tourniquets? Do our EDs have enough tourniquets to handle should a bolus of patients show up that haven't been triaged? They show up in private vehicles or police squad cars, as occurred in Dallas. Are we able to basically be the first responders, stop the hemorrhage, get them stabilized, and then moved on?
And when an active shooter situation occurs, the law enforcement authorities are usually on the scene within how many minutes, would you say?
They're usually there within 3 to 5 minutes. It depends on whether or not the facility is actually staffed with law enforcement. In SUNY's case, it does have armed and unarmed law enforcement officers here on site. Given where they are in proximity to the shooting, they're there within a few minutes. Other facilities that don't have armed law enforcement officers, it may take a little bit longer, but generally in a populated urban area, you will see a response of 3 to 5 minutes.
Tell us a little more about exactly what happens when law enforcement arrives. For example, if someone has been injured by an active shooter, that person might not receive immediate medical care.
Right, and that's one of the biggest challenges and the most unsettling for the basic population is when law enforcement comes in, their only role is to contain the threat. Sometimes there's multiple threats, and so their job is to go find out how many threats are out, actually track them down, put them down in whatever way, shape, or form there are. And then after that, once the area is clear and the scene is secure, then medical attention will be given. So the hardest part for most people to accept is, unfortunately, our law enforcement officers have to sometimes step over the injured or the dead in order to go and try to put down the threat that may be occurring. It seems inhumane, it seems very cold-hearted, but what we have to do is prevent additional injuries and fatalities from occurring.
And Clarence, could you tell us why you think it's very important for an emergency department like the one that you work at here at SUNY Downstate to be prepared?
Well, the most important thing for us is that our staff are aware of all the different potential emergencies that can happen, and to train them in all aspects, all hazard approach to all the potential emergencies. When it pertains to an active shooter, you want the staff to be aware, and we train them so that you don't freeze. And that's the most important thing in any emergency is you don't want anyone to freeze up. You want them to understand the different components of an active shooter and how to respond depending on their scenario. So it is very important, and we truly enjoyed this seminar we had. And I look forward to taking that information back to the staff, turnkeying it with additional trainings in the near future.
So there will be additional staff education.
Absolutely.
And at SUNY Downstate, it's ongoing because we not only prepare for potential of an active shooter situation, but other hazardous situations.
Absolutely. We have a contingent core of volunteers that train in all aspects of emergency management, from evacuations to hazardous materials exposure. We have a complement of a decon team that is all shifts of the hospital, and we train every month, and we run drills quarterly.
And while we've been talking about an active shooter situation at a medical center or a healthcare facility, I think the general public probably wants to know, how can I protect myself, whether it's in a hospital setting or whether it's at the mall or the subway? What are the things that people need to know?
So it's about individual preparedness and individual responsibility. It's no different than learning CPR or first aid to be able to care for somebody who's ill or injured. It's about having situational awareness, understanding that you can't expect everybody to come in and save you. You've got to take some of that ownership on yourself. Where are your closest exits? Who might be a threat? What else do you need to know? Some of the biggest concerns these days in the law enforcement community is the insider threat. So it's the folks that are already in your communities, in your organizations. They work for your facility. They know the ins and outs. So it's teaching your folks, as cliche as it may sound, if you see something, say something. If there's an abandoned bag or somebody's acting suspiciously, you need to take that seriously, because you never know when that person might be an unknown threat to you.
And Dr. Berger, are there any things such as first aid or medical training that the average person might be make themselves aware of that could help them in a situation like this?
Yes, and I'm glad you asked, because that's really been more my focus on this is, say you're in this incident, now the threat is suppressed, but still you have people right there with the casualties who can be rendering aid before EMS can get there, even as quick as they may be. So if you're in a safe area where you're out of the threat, you can start rendering care, bystander aid, so to speak. So self-aid, buddy aid, and until you can get more technical care. So training that the general public would benefit from is how to, about tourniquets, the benefit of tourniquets, not to be shy of using tourniquets, how to stop hemorrhage, not just with tourniquets, but with pressure. You know, it's simple to teach pressure control techniques and other type of hemostatic agent gauze, combat dressings that have been used in the military that easily translate to the civilian sector. And the Hartford Consensus, which is an initiative that is basically pushing this type of training out to the public, has made that training available and those materials, those resources, so that we're going to be seeing a lot more of these trauma kits in malls, in subway stations, in mass gathering like stadiums and so forth, where there'll be these kits, just like we had the initiatives with AEDs for people having heart attacks. So where there's been injuries that have hemorrhage as an issue, there'll be these capabilities to render aid. But the general public needs to know that they're there, and at least some idea of how to use them. Not real complicated, but you need some idea.
Is there training or education available on websites?
There is, and I know that the Hartford Consensus would be one site that people could research and look up. I know that that there's other resources with these trauma kits and so forth. So where the training is made available, or where these kits are made available, usually then they provide training that follows on.
And this is important because, for example, in an active shooter situation, someone could literally bleed out within a matter of minutes. Isn't that true?
That's correct. We used to, in what we call advanced trauma life support, we used to talk about the golden hour. And really, when we're talking about penetrating trauma with gunshots or blast injuries, it's a matter of 5 minutes. We call it the golden 5 minutes now. Someone can hemorrhage that fast, and it's too late.
And you also tell people to run, hide, or fight.
Correct.
Could you briefly explain that?
So that's a Department of Homeland Security initiative, and the City of Houston put together a great video. You can simply Google Run, Hide, Fight and pull up the YouTube video. It talks about the 3 different measures that you can take. Run away if you can. Get as far away as quickly as you can. Take people with you as long as they're not resistant and they're not holding you back. Hide if you must. In other words, you can't run. You must hide. Turn off the lights. Silence your cell phone. Make sure there's no noise coming in. Put some kind of barriers between yourself and the perpetrators. If you're in a room where you have a copy machine, push it in front of the door or a desk or a table. Anything you can do to create distance and barricading between yourself. And if you must, and only if you must, then fight. And the fighting principle is based on if they're coming into the room where you are, you've got to be able to defend yourself. And at that point, all bets are off and you use anything that you can. Fire extinguishers, chairs, vases on people's desks, whatever the case may be, to try and contain the threat yourself. Unfortunately, most of these incidents are over with in about 7.5 minutes, which means law enforcement may not be on the scene yet. And so it may be up to you ultimately.
Well, thank you very much. We're now joined by Vincent Cardoza, who heads University Police here at SUNY Downstate Medical Center. Can you tell us why it is important for campus police units to engage in this kind of emergency preparedness?
What we found in police work, training is everything. It enables people to react in a positive, quicker, and more efficient manner, especially when faced with a terrible situation such as a shooting or a mass casualty situation.
So basically people will know what they're supposed to do rather than have to spend time figuring out what they're supposed to do in an emergency situation. Is that
Exactly.
true?
That's the goal of training, so that it becomes almost second nature. And the reaction time is, much quicker, much more efficient.
And here at SUNY Downstate, we're going to actually be having a drill. Could you tell us a little bit about that?
Sure. So tomorrow morning, our team from Global 7, partnering with the SUNY Downstate Medical Center, is going to put together an active shooter exercise. So we have some folks who portray offenders, perpetrators that will come in, cause a little bit of a ruckus in the emergency room, and unfortunately that will evolve into a situation that involves an active shooter. We've got law enforcement personnel, fire personnel that work with us on a regular basis. They portray the roles of controllers and evaluators, whereas the hospital police will actually be the responding force during this exercise. We have your own personnel that are acting as victim volunteers, so folks who are portraying anyone you would normally find in an emergency room, everything from parents with pediatric patients to food service personnel, custodial staff, etc. Anytime these things happen, an active shooter type incident, everybody who's normally at work is at work, and so we want to create as realistic of an environment as possible by engaging all of those folks. Once the incident occurs, then the chief's personnel will respond to come and contain the threat, as we discussed earlier, and then we'll evolve into the medical response to give the hands-on responders the opportunity to respond to, like Doc was talking about, a mass casualty incident involving hemorrhage control, et cetera.
And in your experience, what do medical centers such as ours or other places that hold similar drills, what do they take from this experience? What do they learn?
So you really can't simulate or imagine a situation like this until you're put into it. What we do is create an environment that's as realistic as possible by bringing in perpetrators who are actually law enforcement officers in real life, but they know the tactics that have been used in past attacks. What we want them to take away from the realism of the exercise is, number one, how you immediately get the adrenaline dump, which can sometimes interfere with your ability to think. Like the chief was talking about earlier, the more you train and the more familiar you are with it, the more likely you are to respond accordingly. We tell people all the time, police officers go to the gun range to use their weapon all the time, because the more you do something, the more repetitive it is, the better it is at second nature. If you think about it, if you discuss it, if you have conversations with your colleagues, what would we do if, then if and when that bad thing happens, you're more likely to respond appropriately.
And Dr. Berger, how do medical staff and nursing staff and other people who actually provide health care, but who normally aren't exposed to any kind of a violent situation, how do they respond in these drills? What do they learn from them?
I think it's the training is everything. So we're used to, in an emergency department, we're used to receiving casualties from shootings or other type of serious events, but they're packaged for us and they're brought to us. The difference here is that we are, the emergency department or the hospital becomes the setting. So now the emergency department is part of that first response, taking care of the casualties before they've been packaged, and having the capabilities to do just that. You know, the question can be raised, where are the tourniquets in the emergency department or anywhere else in the hospital, as an example? So are there tourniquets elsewhere in the hospital or in the emergency department? Because we rely on EMS providing that and packaging it before they get to us. So it's just adding that step and that layer and getting in the mindset that, hey, we may be the ground zero. And that's just a different perspective that most emergency department staff aren't used to. And by exposing, then you're more prepared for it.
And these drills are helpful because it's more than one agency that's ultimately involved if something happens in real time. Is that true? I mean, who else is involved in this?
So for this particular exercise, today we did the learning symposium. We had the Federal Bureau of Investigation, both the response, the counterterrorism unit. We had the New York Police Department SHIELD program here to talk about their counterterrorism response. And then we also had the hospital police. In a typical response, you would see police, fire, EMS. You would have a whole bunch of different law enforcement agencies, federal, state, and local. Generally, any responders that are in proximity that receive the call that there's an active shooter incident will respond. Some are in uniform, some are not in uniform. It creates a lot of complexity. So when we create our exercises, we build those complexities into it, again, to build as much realism as possible.
And it's true when law enforcement officials arrive on the scene, they literally don't know who's the good guy and who's the bad guy, and that can cause confusion.
Right, and that's another piece of confusion for any personnel. They're used to being in their own work environment. There's comfort there. You know who belongs there. You know who doesn't belong there. You know how to get to certain locations without even thinking about it. When these law enforcement personnel come in, everybody is a threat at that point. Doesn't matter if you're a doctor or the hospital president or even the chief of police out of uniform, they won't necessarily recognize them. So what they will require you to do is show your hands, react quickly, don't make any sudden movements, don't try to reach for anything, don't try to argue with them. They're trying to identify and separate the good guys from the bad guys at that point. That can be a little overwhelming and confusing for folks when they're looking down the barrel of one or more weapons, but it's necessary to try and identify who the threat is.
For example, someone might actually be providing emergency care to someone who is wounded, but an officer responding might not know that this doctor is actually performing something that's necessary. Is that possible?
That's quite possible. So until the threat is suppressed, the law enforcement's primary goal is to suppress that threat, and that means getting all the bystanders, identifying the bystanders and getting them out of the way. We always also worry about a perpetrator or other perpetrators, so if there's more than one, blending in with the crowd. And so they've got to make that distinction too and be able to determine, hey, is this someone who's made themselves look like a victim only to cause more harm? So that also is part of that separation. So by doing these type of drills, it just allows the general public, and it throws us working in the emergency department or other hospital staff in that category as, hey, we're in an active shooter situation. We're just like the general public. We need to know what to do when this happens and what we do when law enforcement arrives. When the cavalry gets there, what do we do? Well, we don't jump in and say, I want to help, I want to help. We stand back, hands shown, and do what they tell us to do until the threat's suppressed.
So it's very important to let law enforcement officials do their job.
That's right, and that's part of this training.
And here at the University Police here at SUNY Downstate, you're in constant contact with the local precincts, but if, for example, the FBI arrived, you might not have a personal contact with that. They might therefore
Although
not
we do have
recognize
some
you.
contacts with the FBI, obviously the local precincts, and this particular place, SUNY Downstate, is somewhat complicated. It's 3 contiguous buildings with passageways that, unless you're familiar with, the areas, it's going to be difficult in finding your way. So I think at least our people would be able to act as pathfinders and lead the other law enforcement, to the different locations and to try to eliminate the threat.
For example, a responding officer might want to know what's down at the end of a hallway. Or could you elaborate on that as to how both our campus police officers, but also our employees, would be able to help, say, find the perpetrator?
So the subject matter experts at any facility are the ones who work there all the time. Hospital police are clearly going to be engaged in trying to find the perpetrator and eliminate the threat. In the meantime, facilities personnel, building engineers, they have access to blueprints. They have access to closed caption TVs where law enforcement may be able to come in here, access the cameras, and determine if we haven't found the perpetrator or perpetrators yet, where he or she or they may have gone. They can also track the movement of their law enforcement officers. So while we're trying to find the perpetrators, we can track the law enforcement officers and direct them to the right location.
And I have another question. Would it be useful, for example, for hospital employees to learn how to deal with a patient or visitor who seems to have some kind of a grievance, or is that not useful?
So it depends on the situation at the time. If the customer or the patient or the family member, whomever it is, doesn't show any signs necessarily of physical violence or certainly isn't brandishing a weapon, then of course you should try to use de-escalation techniques and, ask them what the issue is and how can I help you, and gosh, I'm so sorry, showing empathy. If there's any threat of physical violence or they do brandish a weapon, at that point there is no verbal reasoning. It's time to back off and let the professionals come in. Make an immediate notification, let law enforcement come in and do what they're taught and trained to do.
Because once a weapon appears, it's pretty clear that this person is no longer acting rationally, and therefore you really can't reason with that person, and you're only putting yourself and possibly others at risk. Is that the case?
I would agree with that. I'll defer to the chief for further comment on that.
Once a weapon is displayed,
Yes. Should it, at that point, you really rely on,
all bets are off.
Yes.
Call
Yes.
us
Yeah,
immediately.
absolutely. And run, hide,
Run,
if
hide,
necessary at the end fight.
protect yourself,
Absolutely.
and pass on as much information you can to us.
And you have to protect yourself so that you continue to protect others.
You
Because you can
absolutely
be
do.
of service to others later,
Right.
as long as you're living and well.
Yeah, if you put yourself in a bad situation, you become part of the problem. You either become a casualty or you become another individual that law enforcement has to deal with who is potentially a threat.
Well, thank you very much for being on our show. Thank you for coming to Brooklyn and helping us here at Downstate and also with the coalition.
Thank you.
Thank you.
Thank you. Thank you, Ron.